Nightmare on Healthcare Street, or How I Continuously Refuse Treatment to Get Some Fucking Treatment. Let's say you're a woman. Let's say you're a woman born with an orthopedic defect that has left you in a modicum of pain. Let's say you're a woman in pain and want to do something about it. Let's say you're a woman in pain who wants to do something about her health, but because of that pain, you are riddled with both anxiety and depression. Breathe, if you can remember how. Now go get yourself a primary care doctor, kid, because this is going to be a long haul. In 2011, I walked up a flight of stooped basement steps carrying a 50-pound bag of flour on my right shoulder. I was a cook, and cooks carry heavy things and chop a lot of onions. The flour shifted, and the sandstorm within the bag forced me into an awkward grab while going upstairs, bent over on my right hip. The hip I had already had surgery on at 13. It made a creak sound, and every day since that little pop, that little goddamn creak, I've been in an exquisite amount of pain. Exquisite meaning all-encompassing, omnipresent, at times furtive, at times blatantly crippling. Stupid smart pain. My boss talked me out of filing a workers' comp claim and talked me into seeing a doctor at a free clinic. She was little help, having mostly addict or flu-suffering patients. She recommended I see an orthopedic. Now, before the Affordable Care Act, all young people went about their lives and health as young people. Young bodies are healthy bodies, right? No need for insurance. So I stopped pursuing care, hoping that the pain would subside. It did not. And although I quit my job because my boss was an asshat in all things, he told the workers it was because of the pain. The pain made to excuse the otherwise inconvenient truth that he was a shitty boss. I got a job at my uncle's insurance agency answering phones, sitting on a cushy office chair, already perched on my good hip, already standing one-legged in invisible flamingo pose, already getting up with a left leg only, monstrously swaying, like a giraffe attempting to stand from prone. One day, some months after the initial injury, the pain began to nag more persistently, until it was a full-on freight train of painful sensory overload. Deep aches, sharp stabs, nerve pain traveling down my leg, spasms and swelling. The worst was the palm-sized, deep-seated ache in my upper buttock that would have me drifting to sleep, dreaming of being a Barbie doll where I could rip the leg out and swap it for a shiny, plastic, perfect replacement. I went to the ER in the middle of the workday a few days later and was given a prescription for 20 10-milligram Percocet with the pharmacy label reading, "Take for pain 3 times per day, or as needed," and a pair of crutches that I'm still paying for out of my pocket to this day. No x-ray, no follow-up with an orthopedic, just take a handful of opiates and call me never. Once I was able to get onto unemployment insurance, having worked nearly every day of my adult life from 16 to 24, I looked into getting Medicaid to, get the ball rolling on having some coverage for what was shaping out to be a long haul. I made 20 cents too much a month to qualify for Medicaid. No, there is no spend down. Sorry, nothing to be done. The Medicaid rep leaving me in tears to ponder my painful fate. 18 months after finally terming out of unemployment insurance, I reapplied for Medicaid and made an appointment with the orthopedic surgeon who originally did my surgery at 15. He ordered x-rays, then an MRI, this being the common sequence in orthopedic diagnostics. My first experience with an MRI has left me today with an extreme aversion to tight spaces, an instant claustrophobic. Needless to say, neither test showed anything of merit. The doctor seemed almost offended that I would be having pain, now, in adulthood, after his miraculous act of surgery so many years ago. He had me hop on the table, twisted and manipulated my already inflamed joint, poked me so hard that tears sprang to my eyes, and said, "Nope." Nope? Nope, nothing wrong, nothing to be done. Sorry, try physical therapy? Physical therapy was not covered under Medicaid, and my grandmother graciously paid for me to begin seeing a private PT who allowed me to pay far less than the average patient. The kindness of strangers, of family, of friends, far more a buoy than the actual healthcare system. I established with a primary care doctor who prescribed me mountains of Vicodin and muscle relaxers. I became dependent on the pills as not so much a pain relief, but an analgesic to caring about the fact of pain. The primary care doctor mysteriously left the clinic for no good reason, and I was left the challenge of sussing out a new primary. This new doctor would not prescribe pain medicine. We tried every steroidal and non-steroidal anti-inflammatory on the market. Strengthening the joint did not work. The TENS unit with its Tinkerbell dances of electricity did nothing but feel kind of neat. Heat or ice just dulled, did not alleviate. The pills were just hurting my stomach and never took the swelling down. I decided to get a second orthopedic opinion, for which I had to pay per page for the privilege of transferring my records from the original orthopedic to the other ortho joint in town. I received a letter after a month of waiting, and it went something like this. Dr. F's assessment of your condition is accurate. Our orthopedic doctors see no further course of treatment and will be unable to see you regarding your joint pain. We apologize for the inconvenience. So many hours spent weeping to doctors, to billing departments, to insurance agents, to representatives of all makes and models, and somehow it took me 3 years to find a doctor in a city 77 miles away who would take my case. He opted for arthroscopic surgery to see what was going on in the joint and attempted to take out the pins that had been put in by the unwilling doctor so many years ago. Attempted pin removal means the surgeon makes an incision and then attempts to quite literally hammer and drill the pins out. The recovery from that arthroscopic surgery was obscenely lengthy, and naturally, he was unable to get those pins out. I endured 4 extremely uncomfortable cortisone injections in my hip. The best way I can describe an injection of that nature is that something that feels like a metal straw, both foreign and unnatural, is inside your body and is creating an incredible amount of pressure. That something is being touched that never gets touched and isn't supposed to be. Almost like a pelvic exam with that dreaded speculum, although cis men won't get that one. The injections provided an ounce of relief, and this pointed to potential benefits if I decided to go the total hip replacement route. To make the decision at 29 to remove a joint that for all intents and purposes is relatively healthy and relatively stronger than a replacement would be, was chock full of turmoil, to say the least. I opted for it. Dr. C did the surgery, and because of the pins, which had to come out prior to the replacement going in, a little clip was placed around my femur. Looking at the x-rays months later, it's a huge frickin' bobby pin. This entire experience, all I've wanted is a name for the pain, a name for the procedure, a name of accuracy, a name that even if it wasn't well understood, could still be communicated to me as a body seeking an answer. An acquaintance bluntly said one day, "You need to prepare yourself for the fact that there may never be an answer," to which I plumped up in defiance. Oh, I will find it, with or without the help of the healthcare community. I was no weight bearing for a month after the hip replacement, which is atypical in a total hip replacement situation. Nurses and physical therapists visited me multiple times a week. The billings were always screwed up. In a local hospital that takes charity cases and allows patients to continue physical therapy beyond the 20 per calendar year Medicare deems necessary, set me up with my PT of choice, and I went 3 times a week for over 9 months. Although the pain lessened a marginal amount, it is still omnipresent in my life. A force outside of my body originating from within that leaves me breathless, anxious, and weary of society and its blatant trappings. The hip doctor is done with me. The pain isn't from the joint. The massive indent that was present before the massive incision for the hip replacement is still there. Good luck in whatever you choose to pursue next. As if my body is a job and the resume is getting out of hand. I'm seeing a chiropractor now. I'm seeing a back doctor who wants to give me an injection in my sacral joint, who astonishingly was the first medical doctor to ask me if I meditate. I'm trying. I'm singing in the shower for the first time in years. I'm about to see a therapist to deal with the fact of pain. This is all to say, do not for the life of you stop fighting. Do not stop educating yourself on your body and the decisions you make for that body. Be your best advocate and advocate for family and friends who are going through similar experiences. Our failed United States healthcare system is most obviously set up to profit the wealthy. A doctor's word is not gospel. Only you create the laws of how best to manage your body. Don't let them tell you otherwise. Don't let the length and breadth of healthcare journeys beat you down to complacency. Advocate, advocate, advocate. I just had an experience this morning with an OBGYN clinic who wanted me to go through 3 separate pelvic exams because insurance, who had me do a blood test before 10 a.m. because your body's chemical system, not because the blood truck leaves every day at 10. We have to remember that healthcare is run by humans who are running healthcare for profit. Mistakes will be made. Bad advice will be given. You must prepare yourself for advocacy as battle armor. It's a long haul, but hell, it's the only body we get, right? Might as well defend it to the death.